Hello, good afternoon, and welcome to the webinar, Being Pregnant and Having a Baby During the COVID-19 Pandemic. We have quite a few people registered and quite a few people attending already. I'm sure one or two will still join us, so welcome to all of you. Just if one or two people could just let me know if you're hearing okay. You could let me know that through the questions. And yes, looks like good, sounds good. Thank you very much. So I just want to say a couple of housekeeping things. And first of all, I want to introduce myself. I'm Hiltrud Dawson. I'm one of the health promotion consultants and the team lead at Health Nexus. And most of you may know it better as Best Start by Health Nexus. I just was telling my co-presenters there that I'm feeling very reassured because on the news, because people are doing news and stuff from home now, you see some messy backgrounds, and I have a messy background, and I feel I have very messy hair because it was supposed to get cut 2 weeks ago and that never happened. So we will just have to wait and see. So there's Sonia with the lovely long hair, and that looks absolutely perfect. So anyway, I'm hoping you can see the screen and the three of us here. And Sonia in the middle is a lactation consultant, and Susan is a midwife, and they will be introducing themselves in a minute. If you have questions, please type them into the question box. I won't answer them during the piece where Susan or Sonia are talking, but we'll do them afterwards. I'll read them out and the two of them can answer them. Because we're recording the webinar and it will go out to a bunch of other people, other parents will be able to listen to it, so that way they can hear the questions and follow along with what is being said to them. And with that, I should get started. Sonia, I'm just going to let you introduce yourself, and Sonia will be talking towards the end, but I'll just let you do the introduction.
Hello, everybody. I'm a nurse and lactation consultant. I used to actually be with Best Start by Health Nexus, working on the BFI strategy for Ontario. I've been doing lactation work for a very long time between public health and various community things, and I'm working for myself right now. So I'm really excited to be here with you.
Great, thank you, Sonia. And Susan?
I am a registered midwife I'm actually not working, but I am due to an accident, so I am on leave, but I am a registered midwife within Southern Ontario.
Thank you, Susan. Thank you, Sonia. So we're going to move on to covering especially pregnancy and birth. Okay, and Susan and I are going to do this a bit like a talk show, because I only managed to find a midwife yesterday, so Susan did not have a ton of time to prepare slides. And in this changing time, it's not always, we don't have all this time to get ready, and I didn't have time to add too many pictures or icons or things, so we're just going to go with a talk show. And I hope you're all okay with that. So parents who are pregnant right now are feeling anxious about COVID-19, their care during pregnancy, during labor and birth. Susan, can you please speak to that?
So parents in general are anxious about labor, about pregnancy, about outcome. I mean, this is a very, very special time to be having a baby. Now, unfortunately, we have this unprecedented pandemic that is enormous. All I can say is there is so little research as yet, because this is all so fresh and so new, that we can't be jumping to conclusions. We do know certain things so far, that pregnant women are not at greater risk for having COVID-19. There are some other things that we can talk about more in detail that they have started to notice, but also just to bear in mind, and I really want to stress this with everyone, is that being positive for COVID-19 is not an automatic diagnosis of disease. So people can be positive and they can come through this just fine. And thus far, we have not seen any babies that have had any struggle with this, that have come from in utero infection. So that hasn't been established. So I really want to caution people as to what they're reading and how they're reading it. And also to really keep in mind, being positive does not mean disease.
Thank you, Susan. Okay, yeah, so what information is there about pregnancy and becoming sick? You've already answered some of this, but what is there and where can people go to get good information? We've listed a few links near the end of the slides.
Certainly the World Health Organization is a good place to go to. You can go to the Association of Ontario Midwives that will have information as well, some resources. The Society of Obstetricians and Gynecologists of Canada may be hard to access, but I do believe there are some resources online. There is a very good website called virusfacts.ca that people can also access information. Most hospitals that people are planning on delivering at, or if they're delivering at home, they will still be assigned to a hospital through a midwife practice. And those hospital sites also have information available. So what we know about COVID-19 is, as I said before, pretty limited. Most of the studies that are coming out of China. And most of the studies have included about 42 to 60 women, pregnant women who've tested positive, which is, by all accounts, research that would never be considered credible previous to this, because a study of 60 people really isn't indicative of what can go on. But right now, it's all we have. So we do know that pregnancy is a state where women are at a heightened immune response, which means they can get flus and have symptoms that are worse than other people if they weren't pregnant. I mean, your pregnancy uses up a lot of your body's resources. But what we're finding, or what they are finding with COVID-19, that is not necessarily the case. So there have been mothers in China who've tested positive and gone into labor and delivered babies that may test positive, but have not shown any signs or symptoms of the disease. And they still don't quite know why. But they have looked at amniotic fluid, cord blood, they've looked at the placentas, they've looked at the babies themselves and vaginal secretions from the mother. The babies themselves will test positive, but all of those bodily fluids are testing negative. So they don't quite know the physiology behind this. Is this an intrauterine transmission of the infection from the baby to the mother, or is this happening at birth? So it's still they're looking at it intensely, obviously, but most of the outcomes have been really favorable and positive, in that the babies are not going home sick and are not showing up again in hospital having developed the disease. Also, what we do know so far is that most of these women who tested positive have contracted COVID in their third trimester, so in their last trimester of their pregnancy. We don't know enough about what's happening to people who might be contracting it now or 6 weeks ago at the beginning of their pregnancies. All we know thus far is that those women that contracted it later in their pregnancies had a higher risk of preterm birth. Preterm birth meaning probably what would really be considered late preterm. So not the early preterm, which is 20 weeks, 28 weeks or earlier, but around about 32 to 36 weeks is when they're considered preterm, which is really when a baby is quite well and has all the opportunities readily available to just make it on the other side, outside of the uterus. So we don't know what's happening to women who've been infected early. There is a question, one study came out very recently, and literally we're looking at studies that are like March 23rd, there's a different study on March 30th that will say something else. So we're looking, that's how intense this is. So one of the most recent studies had said that there is a question that perhaps about 2%, I believe, of the women who may contract COVID early in their pregnancies might have a miscarriage. Of the women who contract it early in their pregnancy, they're thinking that perhaps 10% might have something that's called IUGR, and that's intrauterine growth restriction, which means babies that are small. Obviously, women's lungs have a lesser capability of dealing with respiratory infections. Partially, it's got to do with hormones, and otherwise, it's also to do with space. You know, the uterus starts pushing up on the lungs. The lungs have shorter, smaller space. Women very normally in a normal pregnancy will be short of breath for those reasons. But they're wondering if this is then causing, because women are short of breath, they're not getting as oxygenated as well. They're creating babies that are smaller. They're growing smaller babies. And what do we do with that? Well, we keep a closer eye. It's called increased surveillance. We would do more growth ultrasounds just to watch those babies to see, is there a point when that baby is actually better off out of the uterus than it is in the uterus of a mother that has contracted COVID and is having some respiratory issues. That's essentially what's been coming out.
Thank you, Susan. That was a lot of great information and well synthesized, because it indeed can be very confusing to look at all the different sites and things that are coming out. And as you say, the information is changing as we speak. So you've already spoken to this, so that if a mother was infected, the baby tested positive, you covered that. So I'm going to go to the next piece. So prevention of infection is so important. What can you tell pregnant families about prevention?
They really have to abide by the social isolation. I mean, that is absolute, that you cannot have lunch with friends. You should not be socializing in your home. You should not be socializing at all. I mean, a lot of the restrictions that we're telling people to do, minimize your grocery shopping, have other people do it for you, have other people help out, really comes from a very privileged place. Not everybody has that kind of support in place. What does the young mom do who has 2 children already? What does she do whose parents don't live in the same city or doesn't have cousins or friends? She has to go out and get her own groceries. If that's the case, then really be diligent. Get us whatever kind of hand washing soap or sanitizer you can get. Many stores, when you go in, are offering Lysol wipes. Wipe down the shopping cart, wipe down whatever bag that you might be using, and try to go much less often. And if there's anything that you can possibly get online, get it online. I mean, I have been saying to people, stock up on your diapers. Not that you need to hoard, but it's about minimizing your need to go out after you've had a baby and while you are pregnant. So really minimize your exposure to people. We do this when we have colds, that we don't want to be around people with a cold. This should be much more extreme than that. Just, we'll come out of this, but we need to do this right now, which is to stay away from other people. Hand washing, hand washing, hand washing. If you do buy anything, try to bring it into the home and sanitize it in one place if you can.
Great, that's really good advice, and I think that's what we're definitely hearing out there from everyone, and makes even more sense in the pregnancy and family context. How can pregnant families ensure they minimize the risk of infection during pregnancy? We've kind of talked about that, I believe.
Yeah.
With just now, but also then during labor and birth, because and during pregnancy they have to go out for some appointments. What is the rule of thumb there? Is there any direction, anything that's being
Well, I know now from midwifery practices, and I'm assuming that obstetrical practices are doing the same, there will be less visits than they may have anticipated. You know, what to do when you're expecting or what to expect when you're expecting, all of those books will be completely out of date right now. So not to be alarmed if you're going to be on the phone with your healthcare provider and they're going to be asking you questions, because this is a way of limiting your exposure to them and their exposure to you. It's keeping as many people as safe as possible. So you may not see your healthcare provider as often, and you may feel that somehow this is not good enough. But all of these healthcare providers are following the World Health Organization's recommendations of how often women who are pregnant need to be seen. And they are trying to do as much as possible, like in this format, over video, FaceTime, and then they will certainly check the baby with heart rate, but at much less amount of visits than they had before. So to be aware of that, to understand that this is not going to minimize your care, it really is just to help and aid in prevention. Similarly, when you go to the hospital, I'm sure your healthcare provider is going to tell you one person is allowed to come with you. So no longer are the days where your whole family can go and sit in labor and delivery and in the room with you while you're in labor. That is not happening. One person will accompany you. And that is based on that one person not having any signs and symptoms of COVID-19, not having traveled within the last 2 weeks. So there will be restrictions. People will be checked when they're coming into the hospital. There was just a story that I saw this morning about a dad in New Jersey who managed to hide and sneak his way into the hospital while his wife had a baby. He was COVID-19 positive. Please do not do that. It puts everyone at risk. So there will be changes. There will be ways that people are going to scrutinize and say, yeah, no, sorry, you cannot have any visitors. You can have one significant person attend your labor and delivery with you. And right now, that's a great privilege. And I think we just have to take that as a great privilege to keep everybody safe.
I'm assuming that discharge will be earlier. As soon as mom and baby are well enough to go home, they will probably be discharged because it's definitely safer to be at home. Is that correct, Susan?
That is my understanding. Many hospitals were trying to do this anyway, and under midwives, most of our clients go home after 2 to 3 hours after birth if everything is well and the mom and the baby are both stable. Absolutely, you are much safer to be home than to be in hospital, and the risk is more increased to getting any kind of hospital infection, hospital-acquired infection. Mm-hmm. But yes, the idea would be to have women who are in labor are considered healthy people. So we want to have them in the hospital and then out of the hospital as soon as possible.
Great. And of course, midwives also offer the option of a home birth if all is well, if there's no added risk factors, which is wonderful. Yes. And then also just going to, now that the baby is born, so how can parents minimize the risk of infection for the baby following birth and of course following discharge once they are at home?
So once again, it is restricting absolutely no visitors, even if you know that these people have not traveled, don't have any signs and symptoms. The one thing about COVID-19 we all know is that we don't know very much about when this was acquired and when people can spread it. So someone who has been well for the last 10 days could become ill tomorrow and have infected you in that time frame. So you really don't want visitors. FaceTiming, Skype with people, but certainly no contact with people coming into the space of the baby. As for parents, hand washing. There has been a recommendation for mothers with breastfeeding that they do a chest wash and wash their hands and wear a mask. Now, this is only if they are a person under investigation or if they are COVID-19 positive. That's the recommendation to prevent the baby from getting the virus. But again, it's hand washing, trying to minimize your exposure to people, and certainly for the newborn to be kept away from others. If there is a person under investigation within the household, that person should ideally be removed or at least in isolation in another room away from the baby.
Mhm. Great, thank you, Susan. And Sonia will talk a bit more about breastfeeding and skin to skin in a few moments. Susan, do you have anything else that you would like to share?
I really think people should be very cautious what they're reading. I know that parents just normally are anxious about pregnancy. I think we have to have good faith in our bodies, eat well, get some fresh air away from other people, obviously, take care of yourselves, but don't panic. There so far in the literature has not been ample evidence that we should panic about pregnant women and newborn babies with COVID-19.
Great, okay. We have, Sonia, we'll do a couple of questions just now and then move on to you. My first ultrasound was cancelled, and I'm wondering if that means I won't be getting prenatal care during the pregnancy. Which midwife or clinic visits are being deemed essential?
So from my understanding is very often the first interview with a midwife from a midwife, OBs might be slightly different or family physicians might be different, are doing the initial, which is around 8 to 10 weeks on the phone. They can then set up, if they do need to, a dating ultrasound, which really is not always required. It's not an essential ultrasound. That can be set up over the phone. There is then a history taking that is a longer interview that often happens, I would say probably at the 16-week mark, and that often happens in person. My understanding is that there are meetings around the 16-week mark, 20 weeks and 24, and then they go again at 32, I believe, 28, 32, 34, 36, and 38. So typically from 36 to 40, we see women weekly, and that's the same of obstetricians. Midwives and obstetricians see women exactly the same amount of times. But it's the earlier ones that are now being handled quite a bit on the phone. And then where there needs to be blood work done or where there needs to be an ultrasound, usually it's the 20th week and the 24th. Those two are quite important, and those are done in person. It's up to the individual practitioner what they do prior to that. But because an early ultrasound, when this person says first ultrasound, I don't know if they're meaning a dating ultrasound or if they mean the anatomical ultrasound. That's unclear, but a dating ultrasound is not necessarily essential, the first one, and certainly does not mean that their obstetrical care would be canceled.
Okay, the next question is, I recently was sick for 1 week with a virus with many of the COVID-19 symptoms. I work in healthcare. I recovered at home and was off work for 2 weeks. I did not get tested. I am 14 weeks pregnant and do not have immunity to fifth disease or cytomegalovirus. Should I be getting tested now after the fact to see whether I have COVID-19, fifth or cytomegalovirus? And some of that may need to go to that person's healthcare provider, right? But Susan,
Absolutely.
do you have any comments, any other comments?
I don't think that I don't think they're able to test to see whether at this point in time, whether she did have an COVID-19. I don't think they would. There will be hopefully a serum test that will come out in the next year or so to see whether people are actually immune to it or not. I wouldn't at this point. She has to make that decision with her healthcare provider. But if she's well, then I would say she's well, her baby is well.
Okay. Okay, couple more questions and then we'll move over to Sonia. Do babies born preterm, 32 to 36 weeks, have a more weakened immune system compared to babies born at full term?
Yes, yes, they do. But they are, and again, you can't speak generally because I don't know why a baby was, it's really dependent on why that baby was born preterm, what the situation was with the mother at the time, what the health was of the mother, but they can and do have perhaps a more vulnerable immune system.
Okay, and then a question that sort of is echoed by two people, and I'm just going to read one of them. I am a nurse and my partner is a paramedic. Are there any recommendations about leaving work earlier than typical for pregnant frontline health workers? Or the other person's asking, should I even be at work?
So from what my understanding is, the SOGC, number of the other communities, the Association of Ontario Midwives, are also not saying pregnant people need to go off work if they're healthcare providers. So that, again, it's a very individual situation. I don't know, certain people may have other health conditions that might make that more of a requisite, but thus far it has not become the recommendation point blank that if you're pregnant and you're a healthcare provider, you have to stop working.
Okay, we're going to move over to Sonia, and there were a couple more questions, and if we should not have the time at the end to get to them, we can answer them individually by sending you that,
Sure.
information. So I'm going to just switch slides here, so just give me a moment to do that. Okay, I'll take it, hand it over to Sonia.
Thanks. So I'm going to just talk about some things around breastfeeding, COVID-19, and skin to skin and COVID-19. And I'm going to cover a little bit of what's generally known about breastfeeding too. So you can go on to the next slide. In the last week or so, I've been hearing a lot of myths, and two of the dominant ones is that in these days of COVID-19, formula is probably safer, so it's better to be extra cautious. And the other myth that I've been hearing is skin-to-skin care can best occur by disinfecting a mother's chest, which has not been the practice. And so those are myths. So what is normal? What are normal feeding recommendations? So in priority order, the normal recommendations are to breastfeed, and this means direct breastfeeding at the breast. It does make a difference how babies are getting breast milk, and so the second choice is actually feeding your own breast milk, hand expressed and or pumped. So just so you know, that it does make a difference to be at the breast directly, because the baby is getting maternal, if there's maternal or infant infections, both stimulate a quick immune response in breast milk composition. So just through the act of suckling, infants who have contact with viruses before their mothers do will actually cause the mother's breast to develop antibodies, and that's if the breastfeeding is happening at the breast. So then the third priority for feeding is feed your own breast milk that's been frozen and thawed before using. The fourth is use pasteurized donor human milk from a milk bank if available, and it's usually more available to, we don't have an abundant supply in Ontario, so it's more available to preterm infants or those with more serious health issues, but it doesn't hurt to ask. And then the fifth priority is commercial formula that's cow's milk based. If you want to know more about formula, there's great resources on Breastfeeding Resources Ontario. There's a booklet, there's videos, and there's handy tip sheets. And I'd like to recognize that mothers do the best job they can with the information they have in their own circumstances. So if you recognize what we're striving for, that's great. And if your circumstances are different, then you need to make a decision based on that. So what's written about COVID-19 and breastfeeding? Well, there's few primary sources, like Susan was saying, and this is really a synopsis of expert recommendations. And what I did was make a cheat sheet for professionals and parents. So if we go to the next
You
slide.
can find that in the handout.
Yes, it is in the handout. And I'm going to be covering a bunch of the content on it. You can go to the next slide.
Okay.
So this is it, or it was. I see your emails now.
You can't see it?
You can't see it? Okay. I see emails that have just popped up. Are they? Are you seeing them?
No, I don't see them. But I see the slide. Do you?
Okay, I also see that. So.
Okay, I'll see what I can do.
So this is the cheat sheet, and there's a lot of information to sift through. Like I said, this is an attempt to synthesize the information. It's basically one page of recommendations, which is what you can see. And I know you can't read it, and that's why you have the handout. And then there's second page is resources and references. Next slide. So breastfeeding, this is at the top of the tip sheet, by the way. It states that breastfeeding is biologically normal and encouraged. And there are known risks to not breastfeeding. In other words, breastfeeding is really important. There's a lot of known risks to not breastfeeding related to infants in terms of ear infections, lung and breathing issues, diarrhea, sudden infant death syndrome, and so on. And also for moms. And sometimes it's the mummy factor that helps them pursue breastfeeding when things may not be going smoothly. And like postpartum depression, type 2 diabetes, breast cancer, and ovarian cancer, moms who don't breastfeed are at higher risk of all those. So breastfeeding is also very protective. And again, I want to say those reasons are all there. But in terms of breastfeeding with COVID-19, there are a lot of antibodies in breast milk. And there's even this fascinating exchange of pathogens or bugs from the baby to the mother with direct breastfeeding. So it's kind of a two-way street, which is kind of newer knowledge. So maybe a baby, like I said earlier, might be exposed to something and pass it into their mother's breast, and then the breasts respond. The World Health Organization states there's a low risk of transmission of respiratory viruses through breast milk, and therefore mothers with COVID-19 can breastfeed. Next slide. So basically sorry, that was that same point. Next slide, please. So there's three scenarios outlined in this document, what should mothers do in the three scenarios. So a mother who has COVID-19, does not have COVID-19, a mom who may have been exposed or has mild symptoms and is home, and a mother who's in a hospital. And then we're going to talk a little bit about rooming in versus temporary separation because of illness. So moms who are at home, if they're not positive, they can breastfeed, and that should be encouraged. If they are positive, what UNICEF says is considering the benefits of breastfeeding and the insignificant role of breast milk in the transmission of respiratory viruses, the mother can continue breastfeeding while applying all necessary precautions. And Health Canada and the Public Health Agency of Canada are totally recommending to also continue. But the big message then is, well, the big message for all of us, baby or not, is tons of hand washing. A lot of hand washing before and after handling the baby. And the additional thing is wearing a mask when with the baby. Next slide. So for a mom who's in hospital and able to take care of her baby, it is encouraged that the mom be in a room by herself, no other patients, when she's known to be COVID-19 positive, and I'm sure that's happening. And also to room in with the baby, and ideally with another adult in the room, a trusted family member, for example. To continue to breastfeed, the extensive hand washing, if needed, feed express breast milk to the baby, and with washing pump parts and the pump as per hospital policy. And if, sorry, I think we jumped ahead a little bit. If the mom is, that's okay, we can move to the others, the next slide. If the mom and baby do need to be separated, say that the mother is needing to be intensive care, then they're not recommending that the baby go there, but she can still be involved with hand expressing or pumping or getting assistance to do that. And to feed the express breast milk should be going to the baby. And again, probably a designated pump. If for some reason she can't continue to, or a loved one can't be there to help express or pump milk, or the nurses can't do that after she's better, then consider relactation, which would take some skilled lactation or breastfeeding support to do. Okay. So relactation, by the way, is just restarting breastfeeding and getting the breast milk going after if it happened to have dried up for a period of time. So that's about it with breastfeeding and in terms of what I had prepared. And then basically the bottom message is feed the baby at the breast as much as you can. And if you absolutely can't because of separation, then try to make sure that that baby gets breast milk. So skin-to-skin contact, again, there were some rumors around that. And what is it? Normally, and this is actually what's still recommended, it's immediate, 0 delay, skin-to-skin contact after birth. So think of Monopoly, do not pass go, do not do this, that, and the other thing, just put the baby directly on the chest of the mom. So no diapering, no bracelet, no weight, no warmer. The point of the warmer in the first place is to provide a nice warm place for baby, but the mother's skin automatically does that. So it is the safest transition for an infant. It stabilizes the breathing, the temperature, the heart rate, so all the vital signs for the baby. It's also very important for bonding. There's maternal recognition. There's the microbiome, which is the normal bacteria that all of us have, that the mother has, and the goal is that the mother and baby get the same microbiome. So if the baby's born vaginally, the baby's already exposed to some of the mother's microbiome or normal microbes that are on her, and then that continues with skin to skin, and that's what we want. And it's even more important in a pandemic. There's maternal recognition, there's stimulation of hormones for breastfeeding, but I also want to say it's really important, no matter how this baby's getting fed, and if a mom has decided, has made an informed decision to formula feed this infant, then skin to skin is still really important. And it is important immediately, and it's also important long term. So we're talking about days, weeks, and months that skin to skin care is actually really good for infants, and it helps with neuronal brain development too. So, and it's really fun too. The infants do this amazing progression of movements, and they see that more when they're skin to skin. So watch your infant closely if you're still pregnant and your baby's still coming, and notice the tongue and the little development that the tongue does, and little mouth movements that they do. It's fascinating as they figure out what to do. The disinfectant is not considered something to be taken orally, and babies do lick the chest as they're finding the breast, and it's not proven safe for infants to consume and may have negative impacts like the ones we're talking about in terms of maternal recognition. So in terms of skin to skin and COVID-19, the World Health Organization and others are saying enable mothers and infants to remain together and practice skin to skin contact and rooming in throughout the day and night, especially straight after birth during establishment of breastfeeding, whether or not the child has suspected, probable, or confirmed COVID-19. Next slide. Of all the preventive interventions, breastfeeding has the greatest potential impact on child survival. And this is true, it was true 3 weeks ago, and it's true today. And I just want to point out for moms, there's Global Health Media has these great videos for parents on childbirth, newborn, breastfeeding, and small baby. And they're really easy to search on a Google search, and I put their link there to make it easier for you. Next slide. Some of the resources you might say, I don't know where to get breastfeeding support. Things are changing, and they are. They're changing by the day. So one place to look, just to sort of get an idea of where to then look, is Ontario Breastfeeds. It's an amazing resource, and it may not be up to date because things are changing daily right now, but it can be a guide for where to start looking. Also, there's a website from the Canadian Lactation Consultant Association called where you can go on and find a lactation consultant. Some of them are publicly funded through our healthcare system, and some are in independent practice. And they're doing virtual and phone consults at this point, so there is some help available. La Leche League is excellent. They've been great for a very long time for peer support and knowledgeable peer support. So they're still available. And your local public health unit, the resources that they have provided are also shifting as they need to second people to the COVID-19 effort. Some people have, some health units have some of the same resources that they used to, and others have shifted, but you can contact them or look on their website. Might be a great place to start to see what's available. And then I have a list of resources here. Say you wanted to have a nice poster on COVID-19 and on breastfeeding, and it's right there. Something that would be immediately helpful to moms is a crib card that has safe skin-to-skin information. And so I would encourage you to print that on cardstock and keep it with you, bring it to the hospital, or if you've already had your baby, to just look at it for the information that it contains, and the information that's on there is solid for moms who are feeding any which way. And on the next one, I just have some of the global, national and international sources of where this information has come from. And the last slide is just to say thank you and enjoy your little one.
Thank you, Sonia. That's wonderful. We do have a few questions again, and just before we go to them, I want to just bring up the other slideshow again, because there were also a few resources. Oh, not from the beginning. Anyhow, let's just click through them. And I just wanted to let you see that some of the other resources that are available. And for example, the crib card that Sonia talked about, it's on the Breastfeeding Resources Ontario site. It's also on the Best Start website, so you can find it there. There is information about prenatal, Healthy Start for Baby and Me. I know that it's not COVID specific, but a lot of the other things will apply. It's kind of a workbook that you can work through. There's a piece about your guide to labor and birth, and the main principles still all apply. There's information about prenatal education messages. It's more for healthcare providers, but it's certainly no harm if you want to look up some of the information there, or the prenatal education program modules. And I believe there is some prenatal education out there that is available online, that most health units have it. And if you're in an area that doesn't, you can probably get the, now let's leave that here. You can probably have the option to join another health unit's prenatal classes. Okay, so let's go to some of the specific breastfeeding questions. And if we get a chance, we'll go back to some of the other questions. Are you able to distribute the slides? Claire will be sharing them, and I will be sharing a link to the recorded webinar. And I think we could also share the slides, so we can make sure that that's all available. So COVID, if there's a COVID mom and it's recommended to wear a mask, is a cloth mask enough? And yes, this is an interesting question, and we were debating that before, because there isn't enough masks for healthcare providers, or they're hard to get out there. So what do mothers do in the meantime?
I would like to say that I had a great answer. There's a lot of people making masks and putting mask patterns online and whatnot. I'm going to say use your judgment. I've seen a picture of a mask that someone shade, and there was all these holes that you could just breathe right through. So, you know, in good judgment, you might say that's not really going to stop little microns worth of COVID-19 coming through. So it needs to be a balance too, because if it's something that's totally not permeable, you're not going to breathe. So all I can say is use your judgment and see who your contacts are, and maybe keep asking around to see what you might be able to find. And in the meantime, you might have to do something that's not hospital grade. Susan, do you have any other suggestions?
I've heard of people actually using things like furnace filters and vacuum cleaner bags to line what you can use cloth and then line with that extra material. You know, it's worth a try if people have them available to them. But those are two of the materials that I've heard about offer more protection than just cloth.
And there is a site that showed you they had tested about 6 or 7 different materials, and yeah, the vacuum cleaner bags came up pretty high, except
Pretty
that
high,
it's a little bit hard to breathe through them. So as
yes.
long as there's that's still doable.
Yeah.
Yeah, and there were a couple of other materials that rated higher than others. Just remembering that it's never the perfect solution, but it's certainly better. Good. Okay, so we already talked about this. Okay, so wait a minute, where are we? I've booked, what is the safest place to be getting any required blood work? I've booked for a C-section at 32 weeks. Is it better now to wait until 40 weeks for C-section so baby has stronger lungs?
I would ask why they're booking to have a C-section at 32. Did she say 32
37,
weeks?
37. I may have misspoken.
At 37 weeks, a baby, and again, I'm not a pediatric expert, but at 37 weeks, the baby's lungs, which is where we have our greatest issue, are really there. Like they're quite, that baby is well to be born. People are saying, I mean, this person doesn't seem to have any indication of infection. I would say not. I would say, you know, it depends on her situation and it depends on what happens in the next few weeks. And she's talking about waiting to have blood work or have her baby done. You have to remind me of that one. She needs to have blood work done?
Yeah, well, they just said, let me just go back to that. What is this? Oh, I think that's actually 2 different questions. What is the safest place to be getting a required blood work? It was a different person with a different question, nothing to do with the C-section.
Okay. The C-section, I think she'll have to talk to her healthcare provider about that if there's any reason to delay it. I don't know why the indication is for 37 weeks. There may have been a previous history. There may be some health concern. It may have to do with other things that I'm unaware of. So she really needs to talk to her healthcare provider about that. But the baby at 37 weeks is good to go.
Good. And then there is another one about blood work, and that fits a bit with the other one. Is the risk of exposure to others while getting the glucose screening test worth it? Would purchasing a home glucose monitor used by diabetics be a viable alternative?
Some midwives are doing the blood work in their clinics. Obstetricians would be sending you to a lab. And I will say, I hope in good faith that most of those labs are doing their due diligence. So again, going in, having your test, leaving, touching as little as possible, washing your hands. I think that's what I would expect out of that situation.
So we are a little bit over time, but if Susan and Sonia, if you're okay, and we've got maybe another 3 or 4 questions here, if you're okay, we'll go over them, and anyone out there who needs to leave, leaves. And the webinar will be available as a recording, so for anyone who missed a piece at the beginning, you'll be able to rewatch it. Okay, so a question about the support person. I'm 35 weeks and wondering if the support person will have to leave after the baby is born if you have a C-section, or does it vary by hospital?
I would say it varies by hospital. Yes. Some hospitals are fine for that person who has stayed, and many of them are asking them to leave after 2 hours.
Okay. And then this question, are there any concerns about later development of the child if the mother has had COVID during pregnancy? And we actually talked about this at the beginning too, or before we opened it up to everyone, because this is so new. I mean, the first cases of COVID in China were in December. We really don't know. We really don't
know.
know
I mean,
what's
the only
going to.
studies that we have are based on SARS and MERS, and those are two, as it turns out, very different respiratory infections, but nothing with the COVID as yet.
Okay, and then there is a question. I have a midwife, and this is my second pregnancy. What are your thoughts on moving to home birth instead?
Well, I'm a midwife, so I will say under the best of circumstances, home birth is always preferable, and that has always been the reason is hospital-acquired infection is less when you're at home. And so now we have on top of it all the COVID. I think a home birth would certainly be something to discuss with her care provider, absolutely, as available to her. Again, I don't know the circumstances of her health and her previous birth, so that would, of course, inform that decision. But bottom line is people have to deliver where they're going to feel safe. And if that is that you're going to feel safe in the hospital, then that's where you should deliver. If you feel that your home might be safer, then that's where you should try to deliver.
Okay.
As long as this is a low risk pregnancy.
Great, great. And I think that answers one of the other midwifery related questions too. But there is a lactation consultant question. What if a new mother needs to see a lactation consultant? Will this still be available, Sonia?
Well, that's a great question, and I did kind of address that on the what resources are available in Ontario slide, because resources are changing. I would say they're even diminishing, but there are still resources. So certainly people in my area, the community health centers are still doing some breastfeeding clinics. And I am still running a breastfeeding clinic, but it's shifting a lot, like, because we have to keep our numbers down, we have to keep people in separate rooms, you have to sanitize in between, and there are places where they are able to do that, and they consider it an essential service, and it's happening. So it might take a little bit of scouting around to find it, but that's why I was mentioning Ontario Breast place to start and look around. The Canadian Lactation Consultant Association has a lactation consultant. So those two resources are available. And then there are a lot of lactation consultants who are moving to do virtual and online consults. So the biggest gap that I anticipate is trouble for mothers to find a place to get a weight check done. And keep asking questions, because there's resources out there, even though there's fewer.
Mm-hmm. So I think with that, we'll close it up. There's sort of a couple questions that are only half answered. And if you feel that they weren't answered enough for you, then please send me an email. And if anyone else has questions, oh, there was one question that already came in by email. What about telling people? Someone hadn't told people they were pregnant and the baby's due in July, and they don't want to suddenly see their friends next with a baby in their arm, but felt they didn't, kind of auspicious sharing good news when there's so much bad news in the world right now. What would you say to that?
Are these people reluctant to tell them that they're pregnant? Is that the
Yeah,
question? Is
they
that
had
the
been,
issue?
yeah, they had been waiting for a specific time or whatever, and now that there's all bad news stories out there, they didn't want to share with the friends and family, hey, we're pregnant, we've got good news. But good news stories are important, right? So this might be the time to tell a good news
Those
story.
stories are important. It really is a discussion with your partner as to, you know, the other side of the coin is it might create more anxiety from other
Yeah,
people.
yeah.
But it also might be very helpful in other people encouraging you to stay put, to stay safe, to do as little as possible where you're engaging with other people.
And there's always the lovely FaceTiming and all those things. Sorry, Susan.
Exactly, exactly. Yes.
So, and that's the note I want to end on. Wait, I just wanted to move this to the last slide so you can all see. I've included a few links to other key organizations there, and including breastfeeding and pregnancy. And I just want to say thank you to everyone. And my email is there, so you can, oh, I don't know why it's there twice. I don't know. The second one is wrong. So it needs a CA at the end. So please contact me if you have questions, and I can send them out to either Sonia or Susan, or get input from others if needed. And please stay safe and stay connected. It's good that you've got yourselves as a community at Life with a Baby and many other places. And thank you again for coming. Bye-bye. And thank you, Sonia and Susan, for contributing. That was very, very good. Thank you.
Take care, everyone.
You're welcome. You're welcome. Nice meeting you.
Yeah. Bye-bye.
Bye-bye.
Bye-bye.